You're probably thinking, what in the world is phlebotomy, also known as phlebotomist? Well, a phlebotomist is a nurse that draws blood. At the end of this video, you will be able to describe 8 hazards faced by phlebotomists and the safety precautions that will protect them. Like any workplace, a hospital contains certain hazards that must be treated with caution and respect to prevent injury. These hazards include biological, physical, chemical, radioactive, electrical, and fire factors, as well as the most significant hazard involved in phlebotomy: sharps in the form of needles, lancets, and glass. Latex sensitivity is also a growing concern in the workplace. Here, we discuss the variety of potential hazards you may encounter and outline the proper precautions to take to prevent accidents or injuries. Biological hazards refer to infectious agents, including airborne or blood-borne organisms such as bacteria and viruses. Actions to prevent injuries include handwashing, universal or standard precautions, personal protective equipment, and isolation procedures. Physical hazards include wet floors, heavy lifting such as boxes and patient transfers. Actions to prevent injuries include avoid running, watch for wet floors, bend your knees when lifting heavy objects or transferring a patient, and maintain a clean, organized work area. Sharps hazards including needles, lancets, and broken glass are the most common hazards you will encounter as a phlebotomist. Actions to prevent injuries include using the safety engineering features as specified for the device you are using, and disposing of sharps in a puncture-resistant container immediately after activating the safety feature. Chemical hazards include preservatives and reagents such as laboratory-grade chemicals. You will encounter many different chemicals in your work as a phlebotomist, including several that can be quite harmful if handled improperly. For example, bleach, which causes irritation of mucosal tissue and skin, is used as a disinfectant in the laboratory. Actions to prevent injuries include proper labeling of chemicals, avoid getting on your body, clothing, or work area. In case of skin contact, flush with large amount of water, and attending chemical hygiene plan training provided by your employer. Radioactive materials are used in healthcare facilities to perform diagnostic tests and deliver treatment. Although the duties of a phlebotomist do not involve direct handling of radioactive materials, you may be exposed to small amounts of such materials when drawing blood from a patient in the radiology department, for instance, or when drawing blood from a patient receiving radioactive treatments or undergoing imagery with a radioactive substance. X-rays are used for diagnosis. Precautions taken by the staff of the radiology department should prevent you from ever being exposed to X-rays. You should not be drawing blood while a patient is receiving an X-ray. There are several important guidelines to follow to minimize your risk. Recognize the radioactive hazard symbol. Exercise extra caution in areas where radioactive materials are in use. Learn your institution's procedures for minimizing exposure and responding to accidents. Electrical hazards in the laboratory may result in shock or fire. General rules of electrical safety apply in healthcare institutions as well, including the following. Avoid using extension cords. Report frayed cords, overloaded circuits, and ungrounded equipment. Unplug a piece of equipment before servicing it. If a piece of equipment is marked with an electrical caution warning, do not attempt to open it, even for inspection. It may contain batteries or electrical capacitors that store electricity even when unplugged. Know the location of the circuit breaker box for the equipment you are using. Avoid contact with any electrical equipment while drawing blood. Electricity may pass through you and the needle and shock the patient. Fires or explosions in the laboratory may occur as a result of chemical or electrical accidents or carelessness, with flames or other fire sources. In addition to preventive measures, the most important steps to take to minimize the risk of injury are summarized in the acronym RACE. Rescue. Remove any patients from the immediate area where fire risk is present. Alarm. Call 911 or the appropriate number for fire emergency in your facility. Confine. Close all windows and doors. Extinguish. If the fire is small and contained, use a fire extinguisher or fire blanket to put it out. Know how to use a fire extinguisher. The proper technique is summarized in the acronym PASS. Pull the pin. Aim at the base of fire. Squeeze the handle. Sweep. Also know the location of all fire extinguishers and emergency exits in your facility. Exit signs should be plainly marked with written escape routes posted around the office or facility. A magnetic resonance imaging (MRI) machine uses an extremely powerful magnet to create images of the body. The strength of the magnet poses significant safety risks when proper precautions are not taken. The magnet is strong enough to pull metal objects toward it from across the room at great speed. Warning signs are posted outside the MRI examination room. Anyone entering the MRI examination room must remove all metallic objects, including jewelry, belt buckles, and even zippers. People with implanted metallic devices may be barred from entering. The instructions of the MRI staff must be followed to prevent serious injury or death. Latex sensitivity is an important problem in the healthcare field. Today, many healthcare facilities have stopped using latex gloves, replacing them with stretch nitrile or vinyl. The reaction to latex products can take a variety of forms such as irritant contact dermatitis, allergic contact dermatitis, and anaphylaxis. Individuals with known sensitivity to latex should wear a medical alert bracelet. Patients should be asked about allergies or other reactions to previous latex exposure. The substances causing latex allergy are similar to ones found in chestnuts and some tropical fruits, such as kiwi, avocado, and banana. Patients should be asked about allergies or reactions to any of these fruits. Safety is a paramount concern in the healthcare workplace. The phlebotomist must pay close attention to workplace safety and learn the most effective ways to avoid hazards such as biologic, physical, sharps, chemical, radioactive, electrical, and fire dangers. Most important of all is the danger of accidental contamination with blood or other body fluids. In addition to specific safety precautions for phlebotomy procedures, a number of general precautions can reduce your risk of injury. Practice hand hygiene. Always wear the appropriate personal protective equipment when handling specimens. Avoid touching your face, nose, or mouth in the work area. Never store food or beverages in the laboratory refrigerator with reagents or specimens. Do not let anything hang loose that might get contaminated or caught in equipment. Protect your feet from spills, slips, and falling objects. Avoid putting anything in your mouth in the work area. Hope you enjoy this video. Thank you for watching.